There are certain diseases that create obstacles, and then not only the patient but also doctors become helpless, such as diabetes that stops the acceleration of life of thousands. In such a dilemma, the history of mankind witnesses that someone comes forward with a light of hope who would create symphony in the dejected life. 1956. Yes, he came forward to create the symphony, not from the laboratory. He derived solution from social engagement and said life should go on by winning diabetes. The name of the solution is the Diabetic Association, and its architect was the professor of the Department of Medicine, Dhaka Medical College, Dr. Mohammed Ibrahim. In its 60-year span, Bangladesh Diabetes Association, BADAS today, is the largest diabetes association in the world. Now, more than 3 million registered patients are regularly taking healthcare service from the BADAS. Dr. Ibrahim's vision was not only to defend diabetes, but also to confirm a comprehensive healthcare service. To fulfill the aim, BADAS has spread out its different services, including research, awareness, and healthcare. Now, after the government, BADAS has become the biggest organization in developing healthcare human resources and services. They provide healthcare services to poor patients from the revenue they earn from the rich, which they call cross-financing. This healthcare system of BADAS is now known as Ibrahim Model worldwide. These features have made BADAS different from other diabetes associations abroad. This association is also putting its mark in the international arena. It had proposed to the United Nations through the Bangladesh government to announce a day as World Diabetes Day. The UN responded to the call and since then observes globally 14 November as the World Diabetes Day. In over the last 60 years, BADAS has opened a number of institutions to expand its healthcare service and health education. Since inception at Shahbag in Dhaka, BADAS was able to draw attention of other patients alongside diabetes due to its integrated treatment method and service. BADAS spends at least 33% of its bed for free treatment of poor diabetic patients. It also has a separate research unit where researchers work full-time. Besides, it has BADAS General Hospital too, which is specialized for women and children. BADAS Nursing College has been established in order to create expert and international standard nurses. It has 4-year undergraduate basic BSc and 2-year postgraduate post-basic BSc program on nursing. RVTC has been established in order to employ and rehabilitate poor young diabetic patients. The National Healthcare Network has been established to ensure proper healthcare besides diagnosis. In different centers and hospitals of NHN, they have projects of health education alongside providing healthcare services. Healthcare Development Project was established to provide international standard healthcare, which is funded by the Dutch government. Ibrahim Medical College has become one of the renowned institutions for medical education in a very short span of time of its commencement. Prominent medical faculties of the country are supervising its graduate and postgraduate degrees. Graduates of this college are now serving in many organizations at home and abroad. Ibrahim Cardiac is a self-sufficient, international standard, one-stop service center for heart treatment that has modern equipment with a pool of expert doctors, nurses and technicians. The university, established at Mirpur's Darus Salam of Dhaka and operating undergraduate and postgraduate programs. Bangladesh Institute of Health Sciences was also established in the same complex. Affiliated Association. Apart from these, BADAS has extended its healthcare services in different districts and upazilas through its affiliated associations, sub-affiliated associations and accredited centers. BADAS has provided training to doctors through its distance learning program DLP, and for this, people from the remote areas are getting diabetes treatment. DLDHC, to extend a comprehensive healthcare service controlled by a certain network, the Distant Learning and Distant Healthcare was formed, where DLP-trained, affiliated associations and accredited doctors could provide their consultations and services. Not only diabetes, but also other patients will get treatment in a very nominal price across the country. BADAS also initiated to provide its service using mobile phones through its call center. The association also initiated micro health insurance to extend its healthcare service for the low-income community, LIC. Another initiative is Sandman Birdham Pharma to provide low-cost medicines to its patients. The association is going to launch a new company to produce diabetes and cardiac-friendly food. This new company will produce and distribute high-fiber, low-calorie and low-GI food in the market. Apart from all these, the association is marching forward with different other projects with a vision to extend its healthcare service. And many patients are now boldly overcoming diabetes for these initiatives.
আমার 24 বছর বয়সে ধরা পড়েছে রোগটা এবং বর্তমানে 80 বছরে পা দিয়েছি। সুস্থ সবলভাবে আমি সব কিছু করে যাচ্ছি। আমি ডায়াবেটিসকে জয় করেছি এবং আমি বলি যে ডায়াবেটিসকে জয় করা যায়।
But research shows that at least diabetic patients are still out of services. And in its 60 years, the association is keen to take up new projects. The president of the association, Professor A.K. Azad Khan, recently won the Global Award of the International Diabetes Federation for his remarkable contribution. Bangladesh Diabetes Association has put an exemplary milestone under his leadership.
এটার বড় হওয়ার যে উপাদানটা এটা অঙ্কুরেই ছিল, কারণ ডক্টর ইব্রাহিম যখন ডায়াবেটিক সমিতি করার পরিকল্পনা করেন তখন ওনারা একটা যুগান্তকারী সিদ্ধান্ত নেয়। সেই সিদ্ধান্তটা হলো যে ডায়াবেটিক বাংলাদেশে কোনো গরিব ধনী নির্বিশেষে সবাইকে ডায়াবেটিক সেবা পৌঁছায় দেবে এবং গরিব হলেও কোনো ডায়াবেটিক বিনা চিকিৎসায় অনাহারে বা কর্মসংস্থানের অভাবে মৃত্যুবরণ করবে না।
A staggering 50% of all the diabetic patients in Bangladesh and around the world are unaware of the disease. Still, Bangladesh Diabetes Association wants to bring the country's 75% patients under its healthcare service by 2025. And to achieve this, the association also initiated to include religious leaders in this journey. The dream is now sky is the limit. Its programs will spread out in remote villages. By winning and defending diabetes